Hi, do you struggle with setting care plans and expectations for your patients?
Welcome to the Perinatal and Pediatric Conversations, hosted podcast by the PPA. I'm Dr. Ashley Emmel.
And I'm Dr. Linda Slack.
And I'm Dr. Jessica Taglerini. You've all heard the saying, planning to fail is failing to plan. It's very important to set clear care plans and expectations for your patients. Patients want direction. Parents want direction for their children. You are the doctor. You're the one with the experience. You're the one with the training. You need to be able to confidently recommend to your patients what to expect. And because every patient is different, and not every patient is going to respond the same way, even with all of your experience, you need to at least give expectations. This is going to take at least, and make sure that you set those expectations for them. They really appreciate it. I know that patients have said to me, when I set my expectations with them, they really appreciate it. How many doctors do testing and exams and have conversations with their patients and don't actually tell them their results or what they think? They never go over it with them. Patients really seem to appreciate that.
Yeah, and I don't know about you guys, but when I started practice, I didn't do any of that. I didn't have a care plan. I didn't really have a plan. It was just adjusting on week-to-week basis, or saying like, I think you're getting better. Let's come back next week. Oh, you know what? You felt pretty good. Great. I think you look pretty good. I'll see you in 2 or 3 weeks. Or just come back whenever you actually have an issue, instead of giving them those actual guidelines of, this is our plan. This is what we're going to do during the plan. This is the expectations that I foresee happening during the plan. This is when we'll do a re-exam. And when you can deliver like that, you're giving more accurate results and expectations for the patients, where they're going to want to come back. They're going to want to continue care. And hopefully they're going to refer their friends and family too, because you've done such a great job.
Absolutely.
Right. And if we don't give them any expectation, then our expectation may be that they should get results in a much shorter time than they actually need to be with you. And then they're not going to be happy about it. And a very good example of that is, we were just discussing this earlier today, is an email that we received from another pediatric specialist. And he was talking about this very thing. When he first started practice, he didn't do care planning either. So taking 2 examples 10 years apart, with 2 infants with torticollis. They both had the same problem. With the first set of parents, he did just what Dr. Ashley was talking about. He just said, come back tomorrow, come back next week, didn't come back when you want to, and didn't set a care plan, and didn't give the parents the expectations of that. The other child, he did. He sat down with the parents and he said, this is going to take 2 to 3 months to resolve, and we're going to work and we're going to see the baby X number of times. And both infants got better, or got resolution of their torticollis at the same time, within 3 months of care. But guess what? One set of parents was thrilled, and the other set of parents were disgruntled. Why? And which set of parents do you think was disgruntled? It was the set of parents that didn't have a care plan, that the doctor just kept every visit telling them when they needed to come back, because they had expected that it was only going to take 2 to 3 visits. We see this all the time in many different circumstances. So really important for us to give parents expectations that are maybe even more than we think it's going to be, because it's always better to have things resolve in a quicker, faster amount of time than for it to take longer.
And there's a big difference between correction and patching the problem. Do you want to be that symptom chiropractor that just says, come back when it hurts? Or do you want to be the chiropractor that corrects what's solving the symptom they're having and the issue they're having, that actually gets them better, so they have that optimal quality of life, not just now, but moving forward? We have to explain the difference to our patients about what it means, that the symptoms are going to resolve sooner than the correction. And so we want to get them to that optimal health, and that's really important. They don't understand that unless we explain it to them, and that's our job.
Mm-hmm. And other healthcare professionals do it too. So I think for a long time, we're like, oh, it's just, if you have a care plan, you're cookie cuttering it for each person. No, you're not. Like, you should be doing that exam, the evaluation, your consult, getting the information from the parents, the child, the family, and then coming up with your best recommendations. So I compare this to a pediatrician. who takes our kids to the pediatrician? Most of us. Do they have a plan? Yes. That first year of life, they have a schedule of when they're going to see you for weight checks and measurements and whatever else you may do with them. But you also might take them in when they're sick. Physical therapist, same thing. When you go in for an issue, they're going to say, I'm going to see you weekly for this amount of time. Mm-hmm. So we're your OB-GYNs, if you're going in, if you're pregnant, they're going in, hey, we're seeing you at 6 to 12 weeks of conception, and now we're seeing you every month, every 3 weeks, every 2 weeks, every week, whatever that may be. Or if you're a geriatric patient, heaven forbid, you're in your mid-30s with them, you might be going weekly. So everybody has a plan. We are not the exception to this, but I feel like a lot of chiropractors make us the exception of, we don't want a patient to think we're over treating or overcorrecting. No, you have a plan. You're getting that patient better and you're following your plan.
Yeah, we have one of the greatest gifts in the world with our hands, and we need to be able to do what we do. And, you know, it's on us to explain it to the patient. So, Linda, tell me a little bit about with a new parent of a first child's born. That parent might have never been to a chiropractor. They've never been their baby to one. They might have gone to many other places before they ended up in your office, or maybe it's the first place they landed. Tell me a little bit about that experience and how you make the parent feel comfortable.
Right. So when parents come into our office, with a baby, they usually have no clue why chiropractic for babies, first of all. And they've just been referred to us through their lactation consultant, maybe their pediatrician in a circumstance, or a dentist if the baby's having issues with tongue tie. So whatever the issue may be, the parent heard on a Facebook group that chiropractic was helpful for colic or for ear infections or for whatever it may be. They walk into our office, but they honestly, most of them don't know what to expect. And even worse, if they've been under chiropractic care themselves, they're worried about bringing that baby in because they are worried that we might be taking the baby and cracking their neck or, cracking their neck, giving them an adult adjustment. And people, the general public does not know that pediatric chiropractic is very different. It's very gentle and safe. And once they learn that, they're much more comfortable with the whole process. But they also don't understand, because of specializing in the brain and the nervous system, it's the most important time of life to see a chiropractor. It should be all throughout your life, but the most important time is when that little brain is forming and when that infant is going from birth to going through their motor milestones, and the brain is growing and expanding, and they're building new connections, and we want it to happen correctly. And we can help to make that happen with a nervous system free of interference.
Mm-hmm. Yeah. This is the kind of thing we go through in our coursework. I am the lead instructor for prenatal chiropractic. And Dr. Linda?
I'm the lead instructor for pediatrics.
And I'm the lead instructor for pelvic floor dysfunction. And just like they've said, this is what we do. And going in, pelvic floor, a lot of times with pelvic floor dysfunction, women have been to all the other providers. And quite frankly, a lot of people don't know what's going on, how to treat it. Maybe their primary just said, oh, it's just spasm, or maybe they've gone to pelvic floor internal work and it's gotten it better, but it continues to come back with exercise or different things. So these care plans are really important of, okay, I'm glad that you've seen all of those other people too, but now let's try to have a plan to work towards correcting the problem and not just putting a patch on it.
So our goal is to give you the confidence and the certainty so that you can bring it to your communities, and so that also, if we have doctors who are not giving care plans, and some saying you just need 2 visits, and some people need 4 visits, it's confusing to the community. It's confusing to the parents, and it's better to give an expectation of how long it's going to take. And if it takes shorter, that's great. If it takes longer, not as great. But there, are a percentage of children or adults who we provide a care plan, and we find that it takes longer too.
Sure. And there's times that you get in, and sometimes I'll say, this is my expectation and plan from all the findings that I found. I hope we can do it quicker. Yeah. But for now, this is the schedule, but don't worry, we're going to be re-examining you. We're going to ask you every time you come in, what changes? How are you feeling? What's different? How are your exercises going? And then we can determine from there, are we on target for what that original plan was, or do we need to modify it?
Yeah, it's always better to under promise and over deliver. I know when a mom comes into my office and her baby is breech, in my experience, it can take anywhere from 1 to 10 treatments to get them aligned enough to the point where the baby can on its own turn head down. And sometimes it happens in 1 adjustment or 2 or 3. Sometimes it can take up to 10, sometimes even more in certain scenarios, depending on how misaligned they are and other extraneous circumstances. So it's important, if I don't set that with my patients on day 1, they're going to think it's a quick one and done thing. And so it's not only important to educate the patients, the parents, but also the healthcare providers referring to you, which is another thing we'll go into on our coursework. So they understand when the appropriate time to refer is, so you have the time to do your job, and they are supportive of you, and everyone's on that same page. You know, just like all the chiropractors should be on the same page, so should the other perinatal and pediatric providers. So we'll teach you also how to get out there in the community and educate the other providers so that they understand and everybody is behind that patient with the same goal.
That's the goal. We want them,
Yeah.
the parents and every patient to get the best care possible.
And if you do everything right, your practice ends up being all referrals, and you don't need to do anything else or spend any other money other than do your job and do the best job you can, setting those expectations.
Yes,
And giving the best care possible, right?
that's right.
So follow us on Facebook, Perinatal and Pediatric Academy.
Or follow us on our website, perinatal-and-pediatricacademy.com, hosted by Ellis Bennis and Floating Axe Technologies.
And we look forward to seeing you on our next podcast.